All know what it feels like to not get enough sleep, right? We can get cranky and make some unhealthy choices as well. What,
Yep.
pizza at 4 in the morning? What's wrong with that?
I've never done that before. All right, and sleep deprivation, it affects kids the same way. It can even lead to lifelong health issues.
Well, health reporter Rose Beltz is with a pediatrician to talk about the role technology plays and how parents can help their children get enough sleep. Good morning, Rose.
Good morning, Brittany. Thank you so much. We are here with Dr. Grandinetti and her nurse practitioner, Kim Resliff, and we are here to talk about, yes, technology, right? It's no secret kids are attached to a device. So what does this mean for their health? And you guys as providers, but also as parents, what do you have to say about this?
Thank you for having us. Yes, there's been multiple studies now that have shown the correlation between media and technology and how it's impacting sleep dysregulation and sleep problems and deprivation with children and teenagers nowadays. In my practice, I can tell you over the years and time, the kids that come in now with just sleep problems or actually are on sleep medications has just increased substantially since the time that I started practice.
Really? So they're actually on sleep medications, young children?
Yes.
You're finding that a little bit more often.
More so teenagers, but the impact of the media and technology and how much it's affecting them and how much they're on it and their dysregulation of their sleep has definitely started to impact their overall lifestyles and ability to function.
So what do you think, Kim, about their long-term health, some sort of implications that this might have?
Well, we know that kids that don't get good sleep have poor focus in school and lack of concentration, but there also might be some implications outside, like for instance on the sports field. If they're not having those quick reaction times due to sleep loss, they are at risk for more injuries. And also an interesting thing is drowsy driving. So especially in the teenage population, big numbers of kids, especially males, may be having more car wrecks due to drowsy driving.
So what is a good number for school-age kids to prevent all these things from happening?
Yep, school-age children, usually we recommend 9 to 12 hours, and then teenagers are usually anywhere from 8 to 10 hours.
Well, that could seem like a lot and a little bit of a struggle for a parent. So what are a couple tips that you could throw out there for anybody that's watching?
I think the main thing is just having a media or technology plan for the family and really turning everything off, either whether it's technology-free zones and specifically limiting it after 9 or 10 p.m. at nighttime in order to help their brains relax and get back into that sleep pattern.
You know, it's funny, I read something, a Harvard professor, he was saying to take away their driving privileges.
That's not a bad idea. I
Right?
think any kind of way that you can get the kids to do it, but I mean, you really should have a bedtime routine. And I think the hard thing is studying in school and they're using iPads and MacBooks and all that, but you have to regulate their time on it and you have to limit it and get low dim lights and off the blue light in order for them to have a good sleep pattern.
No, thank you very much. But so any last thoughts before we wrap here about your practice?
Thank you. We're just opened in October. It's Spokane Pediatrics, and we're enrolling new patients now.
You are, especially with flu seasons. Besides sleep, if you have any questions, right, it's a good time to come down and check you guys out. Well, thank you so much. We'll be back at 7:15 for more on this topic, and back to you guys at the studio.
All right, Rose, thank you so much for all of that information this morning.
Always
6:18, I
informative.
know. 6:18 now on this Tuesday. Well, sometimes we just don't get enough sleep during the night. Our bodies crave a nap. Well, one local doctor says there are just times when you should not give in to that urge.
No.